Communication. Communication is an ongoing, dynamic, and multidimensional process. It's an essential part of client-centered nursing care. A breakdown of communication is a major cause of errors, and it threatens professional credibility. Ensuring client safety and high-quality care is a part of effective communication. Nurses must learn to effectively communicate with the client's family, the healthcare team, and the community. Therapeutic communication is the process in which the nurse consciously influences a client or helps the client to better understand through verbal and nonverbal communication. All nurses' communication can heal or harm. When clients are ill or hurting, their communication skills can be very poor and they can often be hurtful. Nurses should never take Communication is a skill. Critical thinking in communication is going to help control your perceptual biases or your tendencies that interfere with accurate perceptions and interpretations from others. And role-playing is something that can help hone communication skills. There's different levels of communication. Interpersonal is communication that occurs within oneself. Interpersonal is one-on-one interaction. Transpersonal is communication within a person's spiritual domain. Small group is interaction between a small number of people. And public is interaction with an audience. Communication, once again, is ongoing, dynamic, and multidimensional. Referent is the stimulus that initiates conversation. We have the sender and receiver as the next element of communication. This is the person who delivers the message and the person who receives the message. The messages is the content of the communication. Channels is the means of conveying and receiving messages. Feedback is the return message. Interpersonal variables are factors that affect the communication from the sender and receiver. And environment is the setting for the interaction. Different forms of communication include verbal, which is the spoken or written word, and it's affected by vocabulary. Make sure that you speak the level of the receiver, so don't speak at a higher level than what they are capable of understanding. Denotative and connotative meaning are words that have different meanings to different individuals. Pacing is speaking slowly and enunciating clearly. Intonation, realize that your voice tone will affect the message. Clarity and brevity. Effective communication is simple, brief, and direct. Timing and relevance. Make sure that you time messages for the greatest effectiveness. Nonverbal communication includes all types of communication that does not involve the written or spoken word. It involves the senses. Personal appearance. Many things can be inferred from a person's appearance and their expressions. Their posture and gait can infer pain, fatigue, depression, disinterest, disrespect, etc. Facial expressions can convey emotions. Eye contact can convey willingness to learn, anxiety, defensiveness, insecurity, security, etc. Gestures emphasize, clarify, and punctuate the spoken word. Sounds communicate feelings and thoughts. Territoriality and personal space. People can become defensive and may disassociate when personal space is invaded. Art and music can have, symbolic is the next form of communication, where art and music can have healing effects on clients. And metacommunication, all factors that affect communication. It might tell a different story than verbal communication. Professional communication includes the nurse-patient helping relationships, where the nurse establishes, directs, and takes responsibility for the interactions. The client's needs take priority over the nurse's needs. The nurse cannot be judgmental. There's 4 goal-directed phases in this relationship. You have your pre-interaction phase, your orientation phase, your working phase, and the termination phase. The nurse-family relationship. Family dynamics are always important, but especially in this type of relationship. The nurse-healthcare team relationship. Healthcare team must speak a common language. Communication is important to prevent a breakdown in client safety and to optimize client outcomes. Nurse-community relationships. These are relationships that come about as a result of nurses volunteering, becoming active in politics, and participating in local organizations. Elements of professional communication will include courtesy, using your manners, using names appropriately, make sure that you introduce yourself and your status always, and your initial contact with a client should include titles such as Miss, Mrs., Mr., etc., and then determine the client's preferences to their name. Trustworthiness will demonstrate consistency, reliability, honesty, respect. It's the foundation of the nurse-client relationship. Autonomy and responsibility. Again, you have to accept responsibility for your choices and outcomes of your actions. You also need to recognize a client's autonomy. Assertiveness, standing up for oneself without being rude. It is also the expression of feelings and ideas without judging or hurting others. In other words, speak up for yourself without being rude about it. Utilize the nursing process in your communication process. Therapeutic communication. These are specific responses that encourage the expression of feelings and ideas and convey acceptance and respect. Therapeutic communication improves nurse-client relationships. So different techniques in therapeutic communication include open-ended questions. These prompt the client to respond with more than 1 or 2 words. Active listening techniques. Being attentive to what the client is saying. It is facilitated by nonverbal skills. If you remember SOLAR, then you can remember your active listening skills. You sit facing the client, your open posture, in other words, you don't cross your arms or your legs. You lean toward the client. You establish and maintain eye contact. And you relax. Active listening also includes sharing observations, commenting on how a person looks, sounds, and acts without being judgmental or making assumptions. Sharing empathy, which is an accurate perception of another's feelings and the conveyance of this understanding. Sharing hope, which is appropriate encouragement and positive feedback, can help instill hope and self-confidence. Sharing humor relieves stress and enhances relationships when used appropriately. But again, when used appropriately. Sharing feelings. Sharing of feelings can relieve stress and improve illness. It can also enhance the nurse-client relationship. Using touch. This brings a sense of caring and human connection, and it is one of the most potent forms of communication. Just reaching out and touching a shoulder or a hand. Silence. It can prompt conversation, and it allows the nurse to observe nonverbal communication. It also demonstrates patience. Providing information is the provision of relevant information to decrease anxiety, and it also promotes security. Clarifying is another communication technique. You're making certain that the message is understood, and if not, you rephrase the message. Focusing redirects the conversation to keep it on topic. Paraphrasing is the restatement of another's message using your own words. Asking relevant questions can help discover necessary information, but remember, just ask one question at a time. Summarizing is a concise review of the key elements of the message. Self-disclosure is sharing some of your personal experiences intentionally to another person. And confrontation. If it's done therapeutically, it can help the other person become aware of inconsistencies and help improve self-awareness. But we don't use confrontation in a negative way. Factors that can affect communication, or the barriers. The psychophysiological. So what is their physiological status? What is their emotional status, their developmental status? What are their attitudes, values, and beliefs? And their self-esteem. Relational is the nature of the relationship among the communication participants. So if we don't have that nurse-patient relationship, that person may not respond appropriately to me. Situational. Why are you having this communication? Environmental. Is the environment conducive to communication, or there are a lot of distractions and interruptions? Cultural. What are the customs and expectations of the culture and the language? They may speak a different language than you do. They may not understand the slang. They may not understand medical terminology. Non-therapeutic communication involves several different things, such as close-ended questions. These encourage the client to respond with only 1 or 2 word answers. But remember, it does have its place in therapeutic communication, if that is all you're after. Asking personal questions. Inappropriate questions can be nosy and can be invasive. Giving your personal opinion takes the decision-making away from the client. Changing the subject is rude. It shows a lack of empathy and it blocks further communication. Automatic responses. Stereotyping or cliched responses belittles a client's feelings and beliefs. False reassurances. It discourages open communication and it's not based on fact. Sympathy is non-therapeutic. It prevents a clear perspective of the issue and it can show compassion, but it's not as effective as empathy. Asking for explanations might be interpreted as accusations, and it can cause resentment and mistrust. Approval or disapproval. Do not impose your beliefs on others. Approval implies praise. In other words, if you approve, oh yes, you are doing so good, you're praising them. Disapproval implies the client does not meet your expectations. Although active listening techniques recommend leaning forward to indicate interest, be aware of crowding a client's personal space. Being too close to a person can be a barrier to communication. So understand the difference between invading their space and the active listening method of leaning forward in the communication. Defensive responses. Defensiveness in the face of criticism implies that the other person does not have a right to their own opinion. Passive or aggressive responses. Passivity avoids conflict or sidesteps the issue, and aggressiveness can provoke confrontation. Arguing challenges the other person's perceptions, and it denies that person's validity. So the interview process. Once again, the patient-centered interview will obtain data needed for effective treatment and builds that nurse-client relationship. You need to set the stage. Once again, introduce yourself and your status. Use the client's formal name and title, and provide privacy. Set the agenda. Focus on the client. Let the client know why you're there, and ask for a list of the client's concerns or problems. Collect assessment data and the client history using open-ended questions, attentive listening. Make sure that you're watching the nonverbal communication cues, and don't rush the client. In terminating the interview, summarize the discussion. Check for accuracy with the client. Let the client know that you're almost done, and summarize care that the client is to receive, and ask for questions. Do you have any questions? And make sure that they understand what to expect.